Hi, everyone. Thank you all for joining. Today, we have the great honor and privilege of having Kerrie Mitchell with us. Kerrie was 45 when she was given the diagnosis, stage 4 non-small cell lung cancer with spread to the lymph nodes and brain metastasis. She had no symptoms other than a lump on her neck, which she had checked out by her general practitioner. Kerrie is a wife, a mom of one daughter, and continues to work full-time. Almost 3 years after diagnosis and after treatment of immunotherapy, a chemotherapy regimen, and Cyberknife to the brain, Kerrie is currently no evidence of active disease. Kerrie is currently living a full life and working with others to support and raise awareness of lung cancer, particularly among younger women, while trying to remove the stigma around smoking, as one just needs lungs to get lung cancer. Kerrie, thank you so much for your time and your willingness to be here with us. We are really excited to have you and are so happy to hear that you are currently no evidence of active disease. So congratulations.
Thank you.
Wonderful. So to introduce myself and my team, my name is Priyanka Senthil, and with me I have Drake Long and Anish Kukilam, and we are part of the American Lung Cancer Screening Initiative, or ALCSI for short. And we would like to take a few minutes to share about our organization and introduce lung cancer screening. ALCSI is a 501(c)3 nonprofit that works to raise awareness for lung cancer screening, and we're a team of over 200 students and doctors located across the United States. And we do the work that we do because lung cancer is the deadliest cancer in the world, causing more deaths than breast, prostate, and colon cancers combined. Lung cancer causes about 380 deaths per day in the US alone. Lung cancer is very fatal because currently many patients are being diagnosed at a late stage when the cancer has grown and spread to other parts of the body. Lung cancer screening is an effective imaging technique that can be used to screen for lung cancer and has been shown to catch lung cancers early. However, less than 6% of people at high risk for lung cancer are currently getting screened. The screening rate for lung cancer is much lower than the screening rates for breast, cervical, and colon cancers, which are about 70%. We believe that educating people about lung cancer screening is one of the most important and effective ways to increase the lung cancer screening rate for populations that would benefit from lung cancer screening. So far, we've given over 250 presentations on lung cancer screening to universities, hospitals, medical schools, and organizations around the US, as well as India, Canada, Brazil, and Mexico, reaching over 10,000 people. Over the last year, we worked with over 345 mayors from every single US state and Canada to issue proclamations recognizing November as National Lung Cancer Awareness Month. We've also had the opportunity to work with several leaders at the state level, including multiple mayors, Arizona State Senator Leila Alston, who's a lung cancer survivor, Pennsylvania Governor Tom Wolf, and Lieutenant Governor of Colorado Diane Primavera to issue public service announcements emphasizing the importance of lung cancer screening. And in addition to our education, advocacy, and outreach efforts, we recently started a podcast series to share the personal side of lung cancer and provide a platform for lung cancer survivors and advocates to share their stories. ALCSI also worked with US Congress members and senators to draft and advocate for the first ever House and Senate resolutions, recognizing the importance of the early detection of lung cancer through screening. And in December 2022, the US Senate passed a bipartisan resolution for the third year in a row, recognizing November 2022 as National Lung Cancer Awareness Month and expressing support for the early detection and treatment of lung cancer. Senate Resolution 863 expands on previous resolutions by emphasizing the need for efforts to increase awareness of screening among veterans, women, and racial minorities. ALCSI also actively worked with Representative Brennan Boyle and Senator Tina Smith to draft and advocate for Catherine's Law for Lung Cancer Early Detection and Survival Act of 2021. So lastly, we want to end by talking a little bit about lung cancer screening. Lung cancer screening is done using a low-dose computed tomography scan, and this scan uses low radiation doses, is pain-free, and takes less than 5 minutes to complete. The United States Preventive Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer in the US. And right now, they recommend that people between the ages of 50 and 80 who have a 20-pack-year smoking history or more, and who currently smoke or have quit within the past 15 years, get annual low-dose CT scans. 1 pack year is defined as smoking on average 1 pack a day for 1 year, and therefore 20 pack years can be met in a multitude of ways, including smoking 1 pack a day for 20 years, or smoking 2 packs a day for 10 years, for example. If you know anyone who might be eligible for lung cancer screening based on the criteria discussed, please encourage them to take our lung cancer screening eligibility survey so that they can learn whether they are eligible and have the opportunity to connect with our team at ALCSI to guide them through the screening process. And finally, we want to highlight there are other risk factors for lung cancer in addition to smoking, such as exposure to asbestos, a family history of lung cancer, COPD, and previous radiation therapy to the lungs. It is important that we recognize these additional risk factors because a large number of people in the United States who have never smoked still get lung cancer. So thank you everyone for listening to that quick introduction to lung cancer screening. Without further ado, we can jump right into the podcast. We have a few questions prepared for Kerrie, but we will also have a Q&A session at the end with questions from our live audience. So first off, Kerrie, we're so excited to have you. Could you please tell us a little bit more about yourself and your lung cancer journey?
So yeah, I don't think you sort of like said it at the beginning. So I'm Kerrie. I'm a mum of one. I have a daughter that's 17 years old. I have a dog that's the princess and rules the house. And married to James, who is actually Australian. So we live in the UK here. Just outside of about 10 minutes away from Windsor Castle. If you've sort of like seen any of the royal weddings, that's just up the road. So it's a very country kind of area where we live. I work full-time for a company called Oracle Corporation. I've worked there for about 15 years this time. And 3 years ago, a couple of days ago, actually, it was my anniversary 3 years ago, I was told I had lung cancer after I'd gone to my GP with a lump in my neck. He wasn't sure what it was and referred me to an ENT doctor who arranged for a biopsy done on the lump on the neck. And then when I went back in 2 weeks later, I was told I had lung cancer. But because it was an ENT doctor, that's all I knew at that stage. It wasn't until much later I knew more about that diagnosis.
So what was your experience like when you received your lung cancer diagnosis? What were the thoughts going through your mind?
Horrific. It's your worst thing, isn't it? And there's a little bit of hope thinking, because I only had a lump on my neck. I had no other symptoms. There was nothing obvious. It could have just been one of those things. So I wasn't expecting it. And actually later on, when I met my oncologist, who is a fabulous woman, but at the time, she said the words incurable. And so you've been given one blow and then you're given another blow. And I think because, not in that medical profession or anything like that, you hope everything's curable. You hope that medicine has advanced that much, that it's, you've got lung cancer and this is what we're going to do. So then to hear the words incurable, it's like the tablecloth has just like been pulled away from you. So yeah, you can't prepare for that.
So you mentioned being told that it was incurable, and obviously being prepared for that, like you said, is impossible. So in what ways did your life change unexpectedly after being diagnosed with lung cancer?
It was a really strange period, because 3 years ago as well was then March 2020. And I think about a week after I'd met my oncologist, we went into lockdown. So, the medical professions as well were doing lots of things with COVID. So things were delayed. Forceful is probably the wrong word, but I was very persistent. We need to do something. We needed to do it quickly. I'd had a biopsy. Why were we waiting? So I think with me asking lots of questions and self-advocating, what are we going to do and when are we going to do it? Actually, maybe I've sped things up a little bit. Literally, had I been a couple of weeks later, I think it could have all been very different. But I'd already started on that journey before we'd gone into lockdown. It could have been awful.
Yeah, that is really, really just interesting to hear. Just with COVID and all the restrictions that were placed, I'm sure that for a lot of patients who might have been diagnosed during the pandemic, their treatment plans were probably prolonged or delayed to some extent. And I think that definitely could have hurt outcomes. And so, and we've also heard from a lot of other patients that just self-advocating is so important, especially with a disease like lung cancer. Just we've heard a lot of stories from patients who have gone to their doctors knowing something was wrong, feeling that something was wrong in their body, because patients know their own bodies best.
Yeah.
And so they knew something was off, but they weren't having any major symptoms. It was maybe just shortness of breath here and there, or just difficulty breathing or tightness in the chest, and it wasn't screaming out lung cancer, and they were generally healthy. And so it wasn't the first thing their doctors turned to, or they turned to themselves. And so it was, if they hadn't really advocated for themselves and wanted more tests done, it could have been very possible that their cancer would have been found at a much later stage. And we've heard a lot of stories like that. So I think you bring up a really important point on self-advocacy.
Yeah.
And you mentioned that you received immunotherapy, chemotherapy, and Cyberknife to the brain. And could you explain what Cyberknife is to people who may not know what that is?
Yes, so Cyberknife is a type of radiotherapy, but I believe it's a much higher concentration. So there's lots more sort of like X-ray machine bits in this machine that's like a robot arm that just goes around, but because of its precision with all the different X-rays, they're actually able to give you a much higher dose of the treatment than a traditional radiotherapy. So I've never had traditional radiotherapy, but I was fortunate. We only have 3 Cyberknife machines available on the National Health Service in the UK. So I was very fortunate to be able to actually get that treatment at the Royal Marsden in London. And for me, all it was sitting on a table for 45 minutes while this robot just literally went around me. I had a mask on. And then after 45 minutes, I walked out, I went home, I went to sleep, and the follow-up scan was complete response. So it was, I was very fortunate at that stage. And also when it had gone to the brain, it was really early stages, because the first MRI, they weren't even sure whether it had gone there or not, because it was so small. So it was really effective and worked really well for me.
If you feel comfortable sharing, in terms of immunotherapy and chemotherapy, did you experience any complications or side effects following your treatment?
Yeah, so through the treatment itself, I was absolutely fine. I had three rounds of initially I had 3 rounds of double chemotherapy and immunotherapy. And then I went on to what they call maintenance, which was 1 chemotherapy and immunotherapy, and I had it every 3 weeks. And day to day, absolutely fine. I think probably the biggest side effects for me personally was the steroids you have to take before you can have the treatment. So actually it can give you a lot of false energy and you feel absolutely fine. You feel brilliant. You've gone and had this treatment and you come away and you feel fine for a couple of days. And then when you stop the treatment, I used to say on day 5, I'd hit a wall. I'd be very tired. But apart from that, I was very fortunate. I wasn't sick or anything like that. But then unfortunately, after the 8th round, I had very bad diarrhea as a side effect and had that checked out. And it transpired after lots of tests and everything else that I'd developed stage 4 colitis, which had I have had any more treatment, it potentially could kill you, because it was toxic. My oncologist said, it's like your immune system then went into overdrive and it started killing your healthy cells as well, and that's why I developed colitis. So I had to stop after 8 rounds, and subsequently, because the colitis was so bad, I can never have that treatment again. If the cancer wakes up and starts doing anything, it would be detrimental to me to have that treatment. But similarly, my oncologist said, sometimes, ironically, that can be a good thing because your immune system has gone into overdrive. So I liken it to, I think I've had a hard set reboot, that, it was like shut it all down and then start again. And yeah. So, but the day-to-day stuff, no, I was fine. just took eight rounds, and then I really was not fine.
Well, that is wonderful to hear. We're really happy that you had a positive experience for the most part up until the
Yeah.
end. For patients with advanced lung cancer, when they hear about chemotherapy, especially, they get really worried because it's oftentimes associated with hair loss and just feeling really weak. And I think for a lot of individuals, it's not as positive of a story. And so what advice do you have for maybe other patients, not necessarily with just lung cancer, but any cancer who might need to undergo chemotherapy or these other treatment regimens? How can they mentally, physically, and emotionally prepare for this journey?
I think that the mind is sort of like a powerful thing, isn't it? So, anything my oncologist said, I took literally. Had my oncologist said, right, do a headstand every day for 5 minutes, I literally would have done that. I would have worked out how to do that. One of the things she said, now is not the time to go on a diet. Now is not the time to cut out sugar. Now is not, you need your strengths. You need to eat everything. You need to be strong and gain weight. So I did. And I looked for, foods that are meant to be good for lung cancer, and just thought, well, I'll have smoothies with all of these fruit things. And I think mentally you're just thinking, I'm doing it as much as I can to prepare myself. I took up walking, and I would walk for an hour every day and try and get myself out of breath, because then I was thinking, well, it's gonna exercise my lungs. So I think you have got a choice. You can either sit in the corner and go, poor me, oh gosh, this is awful, or you can't control your treatment because you trust your oncology and your medical team to do that for you, but you can control how you're going to then be while all of this is going on, to keep you happy and mentally okay, and also allowing yourself just to have to cry and get frustrated and stuff. That's really normal.
A lot of people we talk to mention that because of the shock that they're in initially, they don't necessarily know how to talk to their PCP and what questions to ask. So, what advice would you give to someone newly diagnosed to ask or prepare for speaking with their PCP?
I think, sorry, what's a PCP? It might be an American term.
Oh, I'm sorry. Your primary care physician.
Okay, cool. Yeah. So again, it's doing research, but doing it in what I would call the safe sites. So don't go to Dr. Google, because that's really not a safe place to go. My husband and my sister did a lot of research for me on core sites, and also looking at patient stories. That was huge for me, and gave me a lot of hope, understanding what other people's journeys were, what treatment they had. So I have like a file on my phone. I'll be, what about this? What about this? Why are we not doing surgery? Why are we not kind of out? Will we do radiotherapy? Why aren't we doing radiotherapy? It was like, help me understand why you're making your choices. And then I think you get a gut feel, I think, for your medical team. I got a gut feel. I was like, okay, I don't like what she's saying. She told me like it's incurable, but I very much came away going, but she knows her stuff. She absolutely knows her stuff, and I'm absolutely going to put my trust in her, because I know, I just sense she's absolutely going to do the best for me. So, do your research at safe sites. Look at other patient stories, what treatment they had. I used, not at the start, but now, like Instagram a lot, because I think you get quite a lot of information on there outside of notice boards that might be on some other social media, and just ask the questions, because sometimes I think they forget, they're there to fix you as much as possible, and they probably maybe focus on that, which is right, but maybe don't talk about why they're not doing other things. So just ask the questions.
Yeah, I think that is really great advice. And you had mentioned just connecting with other patients, and I think if you're able to connect with other patient groups and just individuals who have gone through something similar, even if it's not the exact same type of lung cancer or same stage, just talking with someone who's been through similar emotions, I think that is very helpful. And there are a lot of accounts on Twitter and Instagram where people are sharing their story publicly and are wanting to create this community. So I think social media is a great way to get connected. And then, as you had mentioned, it's really important to find, the care team that's right for you. And that might, some patients are fortunate to find their care team immediately, but for other patients, it might take a second opinion. And so
Yeah.
a lot of patients have said that, they are glad they went to get a second opinion and just felt more confident about their treatment plan and felt like they had a better holistic view of everything. So yeah, I think that is wonderful advice.
Yeah. Yeah.
And so switching gears a little bit, we wanted to ask if you could share what lung cancer screening looks like in the UK. So in the US, we have a national lung cancer screening guidelines set up by the United States Preventive Services Task Force, which we had talked about at the beginning of the podcast. And so we wanted to ask, are there national lung cancer screening guidelines in the UK, and are there lung cancer screening programs in the UK like there are in the US?
Yeah, so there is a lung cancer screening in the UK. I don't know lots about it. So it's part of the National Health Service, and they target people between the ages of 55 and 75 that have smoked. So that's the criteria. They don't specify how many you've got to have smoked and how long, that you just have a history of smoking, whether currently smoke or prior smoking. And then you will be invited to have screening because you're at that risk group. And that's it. That's just open nationwide. In the same way for mammograms for women over 50, I think it is. So it's, you will be invited, we've identified that you're in this group and you're invited to come and have some screening, and that's based on the medical records.
Currently, lung cancer is often known as, the smoker's disease, and there's a lot of stigma surrounding lung cancer. But like you said at the beginning, anyone with lungs can have lung cancer. So did you have any misconceptions about lung cancer prior to being diagnosed?
Yeah, I thought it was the same as the stigma. I thought you had to be old, and predominantly male and a smoker. And it was, I think it was I had an ENT, was the original doctor. Then it was a respiratory consultant, and then my oncologist. But the respiratory consultant, he did say to me, yours is the non-smoking one, because I did have a history of smoking. Although I'd given up 10 years before, I did have a history. And he said quite quickly, it's got nothing to do with smoking, your lung cancer, so don't be beating yourself up kind of thing about it. But there is that perception, and I think it's probably still more common maybe in older people, obviously with a history of smoking. But I've met a lot of people, particularly women, and they're young women, and the majority of them have got no history of smoking. So the stigma really, for me, doesn't reflect the reality.
Had you heard about lung cancer screening before, and did you have any concerns about it?
No, I'd never heard of it before. Wasn't aware. I think I was probably aware that if you went to the doctor with a history of smoking and you had a cough that wouldn't go away, they'd potentially send you for an X-ray as a precaution. But no, apart from that, no, not really. And I think it's still quite a recent thing here in the UK. But actually, it's a great thing from stories I have seen. I've read a couple of stories about people that did take up the invitation to be screened because they fitted into the risk category, and actually they did end up having lung cancer because of the screening. They were identified at either stage 1 or stage 2, which is brilliant because that's very much curative, caught at the early stage. So that's fantastic from so many things. Obviously, we all know for lung cancer, normally the symptoms come when you are at stage 4, and anything before that, well, to get stage 1 or 2, it's normally discovered by accident.
Yeah, I think you hit the nail right on the head. It's, we know lung cancer screening is really effective in helping to catch lung cancers early, and then as a result, also reduce lung cancer mortality. But a lot of people in the US and in other countries don't know about lung cancer screening, and even for individuals who've heard about lung cancer screening or know something like that might exist, they don't know the exact criteria and who should be getting screened and what the risk factors are for lung cancer. So it's difficult to know, like, am I eligible for lung cancer screening? Are my family, friends, are they eligible for lung cancer screening? And so I think that is one of the major contributors to the low uptake of lung cancer screening in the US and other countries, is just a lack of awareness. And I think we've made a great progress in other cancers like breast cancer, and especially I'm not sure what it's like in the UK, but there's a really great awareness around breast cancer screening as well as cervical cancer screening and some of these other common cancers. And for a lot of patients, they usually will, they'll usually talk to their PCP about this during their visits, especially if they are, for breast cancer women within that certain age, after a certain age, this is a conversation that they have routinely with their physicians. And that same level of awareness hasn't been reached for lung cancer. And I think if we're able to get it to that level where doctors and physicians, any healthcare provider, knows about lung cancer screening, knows about the guidelines, knows who needs to get screened, and are able to talk to patients about getting screened who are at high risk, that can really help to increase the lung cancer screening rate. Because right now, for many patients, they're hearing about lung cancer screening through other venues, and then going to their physician and saying, I think I might be eligible, can I get screened? And it really shouldn't be the patient's burden to ask about screening, but should be something that healthcare providers are all educated about and are able to identify those who might benefit from screening. So I definitely think that hopefully in the future we're able to raise awareness and education to that extent where we're able to identify patients who might benefit.
Yeah, and I think as well, because your guidelines are very similar to ours on the screening, but then we also have some other guidelines for the NHS. If you present with a number of symptoms, depending on your age and your smoking or non-smoking history, depends on whether you will get referred for further tests. So at the moment in the UK, if you're under 40, you don't really qualify. They don't think that you might have lung cancer, because on the guidelines you have, if you're over 40, you need to present yourself, I think it's with like 2 or 3 symptoms before then screening happens. But if you're have a history of smoking, I think you only have to present with 1. So the guidelines are quite different if you are presenting with symptoms. And I think exactly to your point, if we can help educate the healthcare sector more, that actually you don't have to be over a certain age and you don't have to have a history of smoking, then I think more people would get diagnosed as well, and not misdiagnosed.
Right. Yeah. And I know we talked about the stigma earlier, and I think stigma, unfortunately, it still exists around lung cancer, and that stigma, I know for some individuals, it is a point of hesitancy to get screened or to even talk to their physician about lung cancer screenings. And if they do end up getting a diagnosis, that diagnosis might come with a lot of shame and guilt for that individual, given the stigma around the disease. And I think it's so important that we raise awareness that while smoking is a primary risk factor for lung cancer, a lot of individuals who are diagnosed with lung cancer, upwards of 10 to 20% in the US, have never smoked. And even for individuals who might have a smoking history, their lung cancer, like as as in your case, for example, might not be due to their smoking. And I think it's also for individuals who haven't undergone that struggle, it's really difficult to understand that smoking is an addiction, and it's really hard to quit smoking. It's not just about willpower or wanting, or how much an individual wants to quit, but the effects of withdrawal, are physical, emotional, and mental. And so it really is more than just, you know, a person's desire to quit. I think just opening up conversations about that and really being careful about the way we talk about lung cancer, and even moving towards patient first language instead of saying, you know, talking about individuals as, you know, a 50-year-old smoker or something like that, you know, moving more towards person first language, where we say instead, you know, a 50-year-old individual who has been smoking. So something, just changing our language and the way we approach lung cancer, I think, can really help make it less of a, make screening, just open up screening more for individuals and not have to worry about, you know, maybe some of the societal repercussions that might come from a diagnosis.
Yeah, no, and it's very true. I mean, I listened to a professor on a call some time ago, and you know, he just said, you're just unlucky. You know, not everyone that smokes gets lung cancer, and then obviously people that don't smoke get lung cancer. So you are just unlucky. But on the stigma side of things, I had a conversation with a doctor not that long ago, actually, and they were asking about family history of illnesses. And my mother had bowel cancer, and my father had throat cancer, and then I said about my lung cancer. With all the other ones, they were like, oh, and then I said lung cancer, and they said, do you smoke? And that was a doctor, and I did think you had no comment about all the other cancers, but you did on the lung cancer one about smoking. So it's going to take a long time to get rid of that stigma.
Right, absolutely. And as you, as in your example, it's not just community members, but even, you know, within the medical field, I think we're going to need to do a lot of education and just discussion, but it's not, you know, it's also prevalent, unfortunately, in the medical field.
Yeah.
And so we wanted to ask, what motivates you to share your lung cancer story so publicly? Because, you know, it is a very personal story, and I'm sure it's, you know, not an easy one to recollect or talk about. And so what motivates you to share your story openly?
I think what it is, it's one about the awareness and to give other people hope in the same way. I'm a true believer in the word, like, pay it forward. You know, I was seeking out the stories of the younger women that had got lung cancer and wanting to sort of like look for stories of hope and good news stories, you know, because they give you a positive sort of like feeling about what you know could be. So therefore, you know, when I was comfortable talking about it, and it did take me a while to be, I wouldn't even say comfortable, be able to talk about it, then I did it in what I thought was a safe way. I did it on a social platform. Then I could kind of like, right, okay, let's put my feelings all out there and just chuck it there. And then people would say, well, that was really helpful. That really helped me, or that really helped my mum. I was like, okay, well, if that helps, if my story helps some, you know, one other person, then that's a good thing. And, you know, we naturally all get these endorphins anyway, feel good things, if we know we've helped somebody. So, you know, nobody wants to be famous for cancer. So it's not about like get yourself on social media, you know, but if your journey can help somebody else to challenge even their diagnosis or their treatment plan, if it doesn't feel right, then that's good.
We really admire your efforts in the lung cancer community. So could you please describe some of the things you are currently done or have done in the lung cancer community?
Yeah, so in my own part, I've done some like fundraising. So I took up swimming and took on some swimming challenges to raise funds for Roy Castle Lung Cancer Foundation, which is a major charity in the UK focused on lung cancer and helps drive screening programs and works very closely with the NHS with certain initiatives. So I started doing things there on fundraising, but also did patient stories for them, because that's actually where I went and read my first stories, looking at other people. And then I found on Instagram, started to find people on Instagram other, women similar to myself, with their stories about lung cancer. And then more recently, in the last 6 months, there is a group of us that talk quite regularly, all women, all, stage 4 lung cancer. And we've got a little community going, and we try and pull together things that we find out or we know to try and let other people know what they are, whether it's there's a new drug coming, or there's a new campaign, or whatever it is. Just trying to put information out there that might help other people, or give them hope. And it's really, talking to other people in a similar situation, of a similar demographic, it's quite good because they get it. It's, your friends and family are obviously super brilliant and super supportive, but this other little community, they get it. They get all the the highs and the lows kind of thing that we go through every 3 months.
So, on the note of your friends and family, for someone who had a loved one who recently was diagnosed with lung cancer, do you have any advice for how they can best support and help them?
I think it's down to the individual, really. I know my husband wanted to fix me. So he would be researching all of the time. Here's a new thing here, here's something in this country, and that made him, that's how he could contribute. That's how he could try and help and fix me. Whereas my sister, say for example, would go, what do you need me to do? I've looked at this and I've found out about your treatment and all of this kind of stuff, and feed me the good news things. So I think, it's just awful for the family as well. You all go through it. And actually, well, I know I was pretty grumpy and irritable and everything like that. We don't mean it as well. So just, sometimes let us rant, or, blow our gasket and stuff. It's, we're struggling. It's come new to all of us. So, just being there, bring them a cup of tea. Say, what is it you need me to do? Go for a walk. Everyone's going to be different. They really are. But I guess asking, the individual, what is it that you need me to do to help you? And it could be one of many different things. It might just be, just sit here and hold my hand. I'm just going to sit here and cry for 10 minutes. That might be exactly what they need.
Right. Yeah, that was very well said. Sometimes it's just the small things that really make a difference. So having cancer changes so much about life in general. And so what words of wisdom do you have for people post-cancer as far as being able to live a full life once more?
It would be take control where you can. You're not the doctor that's going to give you the treatment regime to fix you. So take the control where you can, and what's going to make you happy. Because whilst positivity is not going to cure you, it actually is going to help you if you've got sort of a positive outlook. That actually day to day, I think it probably makes things a lot easier. I personally, I try and do something that I really enjoy every day. So the little things that maybe I used to take for granted, I do them in a slightly different way now, and kind of special. And if in certain ways you're lucky, because all the things that you might have put off for another day, you go, okay, let's do them now. Why are we saving these things for best? Let's just do it now. Go to that restaurant, put on that top or whatever when you're in the kitchen. We all had COVID, dress up, do whatever it is that's going to make you happy, even if it's little things.
So we will now be moving on to a couple of questions submitted by the general public and ALCSI members. So for our first question, do you have any advice for people looking to get involved in the lung cancer community?
Yeah, if you want to look at the charities, that's a really great way. Most charities look for advocates. So people, and they will look for various different people. They'll look for people that are just starting on their lung cancer journey, or friends and family of, there will be lots of different roles that you can play that will really help charities. And normally if you start to do things with the charity, they might start putting you in touch with other people, and you can do as much or as little as you like. But find a charity that's close to you geographically or of particular interest to you, and just ask them, how can I help?
How can we best educate the upcoming generation about lung cancer screening?
I think it's about the self-advocation again, and about your body better than anybody else. So if you're going to a doctor and there's something wrong and they say you're too young for this, or you're too fit, or you're too healthy, but it's not right, you are really going to have to persevere and make sure that your voice is heard. So trust your instincts and self-advocate. Where for the next generation, technology helps us a lot because there's a lot of information out there instantly. So do your research, self-advocate. Unfortunately, you're never too old, never too young to get cancer. You're just unlucky.
Wonderful. And this is a tough question, but if you have to summarize your journey in one sentence, what would that be?
In one sentence?
Yes.
It's a terrifying, one sentence. I'm just trying to think. It is a terrifying black hole that you go down, but actually when you're going down this black hole, there are bits of light along the way that is really quite nice as well. But yeah, no, it's not a positive. It's terrifying. It's terrifying. Somebody's told you you're not going to get to be 90 more than likely. You are going to die sooner than that. That's not. Yeah, sorry, you asked for a sentence. I just
No, that's perfect. Thank you. And so for our last question, before we wrap up our podcast, we wanted to ask, what are you looking forward to most in the next couple of months?
Holidays. Holidays. So yeah, I had a big, always wanted to go to this country or that country. I do it now. So this is the thing about don't save it till best. I do it now. All the countries that I want to see, I go and do them. So yeah, I have a few trips planned that I'm really looking forward to. Of places on my living list.
Thank you so much, Kerrie, for taking time out of your day to share your story with us. We really appreciate all the work that you're doing to help raise awareness about lung cancer. And thank you everyone for joining our podcast. Please keep an eye out for our upcoming podcasts and events, which will be listed on our website, www.alcsi.org. In a few weeks, we'll be having a podcast with Dr. Gerald Winehouse, a pulmonologist and medical director of respiratory care services at Brigham and Women's Hospital. Zoom registration and information on our upcoming podcasts can be found on our website under calendar events or in our Instagram bio. Thank you and have a great day, everyone.